Hello, how are you? Today I'm so glad you guys finished the 75-hour class. Today we're doing the delegation. Last time we did the delegation training. Today we're doing the delegation, but we're doing a delegation with diabetic. And I have the book right here. And before you take this class, you have to make sure you took the delegation training, which is 9 hours, and this one is a 3 hours class. Chapter 1, let's go to chapter 1. This is your book, by the way. You can find it online. Now we start lesson 1. Lesson 1, let's go. Here we go. So we're doing module 1 today. Module 1 has 3 lessons. Lesson 1 is diabetic overview and management. Diabetic is a chronic health condition of the endocrine system in which the body does not properly process food and energy. The endocrine system is made of several glands that produce hormones which help control body functions. The pancreas is one of these glands, located in the upper abdomen behind the stomach. As you see in the picture, the islets of Langerhans or beta cells are clusters of cells throughout the pancreas that secrete insulin and glucagon. The purpose of insulin is to carry glucose from the bloodstream into the cells for use as energy and fuel. Glucagon releases when there is a drop in blood sugar, preventing blood sugar from dropping too low. It does this by promoting the liver to convert stored glucose into usable form, then release it into the bloodstream. We are still here. The pancreas has 2 important functions. First, it makes enzymes that break down food in intestine, like lipase, it breaks down fat, and protease breaks down proteins, and amylase breaks down carbohydrate. And the second purpose of the pancreas is it makes hormones that regulate blood sugar level. The hormones are insulin and glucagon. How the body processes food for fuel or energy. Let's talk about that. As food digests, carbohydrate break down into glucose or sugar and passes from the intestine into the bloodstream. Insulin transporters or move glucose from the bloodstream into the cells of the body. Insulin acts like a key that opens the door to the cells so glucose can enter. Once the glucose is in the cells, the body can use it for energy. Glucose is the main source of energy for our cells and preferred source of fuel for our brains. When diabetic occurs, let's see. When diabetic occurs, what happens? The pancreas makes little or no insulin, or the body cells do not respond to insulin. This is what the diabetic looks like. In either case, the body does not make insulin. The pancreas makes little or no insulin. In either case, glucose cannot move into the body cells. Instead, it builds up in the bloodstream. Even though glucose is available, the body is unable to use it. The cells now lack the fuel they need to work. Over time, having too much sugar in the blood can lead to serious complications. This may include heart disease, stroke, kidney disease, eye problems, gum disease, nerve damage, and foot problems. Blindness, amputation, these may also result from these complications. There's 3 types of diabetics, so we're gonna see each how it looks. 3 main types of diabetic. Diabetic 1. Diabetic 1 is a chronic disease caused by an immune reaction where the body's immune system attacks the beta cells that produce insulin. As a result, the body produces very little or no insulin. The exact causes are not yet known, although research suggests a link to a combination of genetic and environmental factors. The fact that we need to know about type 1 is it's usually called juvenile diabetic because it begins at a young age and is usually diagnosed in children, teens, and young adults. The body produces very little or no insulin and always requires multiple daily insulin injections or the use of an insulin pump to maintain blood glucose levels. Without access to insulin, people living with type 1 will die. So it's very serious. Approximately 5 to 10% of people who have diabetic type 1 and symptoms of type 1 diabetic often develop very quickly, usually diagnosed in children, teens, and young adults. Currently, we don't know how to prevent it. There's nothing out there. Type 2 diabetics. With type 2 diabetic, the pancreas produces insulin, but either not enough insulin is produced or the body does not use it effectively. As a result, glucose from the food builds up in the body. Facts that we need to know. Usually occurs in people over age 40 who are overweight and have long-standing poor eating habits. Increased diagnosis in children, adolescents, and young adults. This is due to rising levels of obesity, physical inactivity, or poor diet. It can develop slowly over time and may not be diagnosed for several years, or symptoms may go unnoticed. About 90-95% of people with diabetes have type 2. Type 2 diabetes can be prevented or delayed with health lifestyle changes such as a healthy diet, regular blood tests, exercise, or maintaining a healthy body weight, and oral medication. As the disease progresses, insulin may not be prescribed to help glycemic control. Insulin is important. And the third one is gestational diabetic. This one occurs during a woman's pregnancy and is a result of the body's increased need for or demand for insulin as her pregnancy develops. It may cause complications to both mother and baby, but the facts that we need to know about gestational diabetics are this is the result of body's increased need or demand for insulin pregnancy and treated with diet and exercise, sometimes medications. When the baby is born, gestational diabetic disappears, but not all the time. Women who have had a gestational diabetic are high risk for developing type 2 diabetic. According to the CDC, 50% will go on to develop type 2 diabetic. Now we finish lesson 1. Now let's go to lesson 2. There's some questions in here. You're welcome to do it. Lesson 2, hypoglycemia and hypoglycemia. The American Diabetic Association, ADA, generally recommends the following target blood sugar levels between 80 to 130 milligram per deciliter before meals, or less than 180 milligram per deciliter 2 hours after meals. Hypoglycemia is a technical term for high blood glucose, also called high blood sugar. It occurs when there is too much sugar in the bloodstream. Hypoglycemia is blood glucose greater than 130 milligram per deciliter while fasting and greater than 180 milligram per deciliter at least 2 hours postprandial after eating. The signs and symptoms are related to high levels of glucose in the blood and lack of energy available to the body cells. The most common signs and symptoms of hypoglycemia are 3 of them: polyuria, excessive or increased urination; polydipsia, increased thirst to make up fluid loss from polyuria; or polyphagia, which is increased hunger. Other common symptoms of hypoglycemia include unusual weight loss, blurred vision, fatigue, and irritability. There are like acute complications and chronic complications that are caused by hyperglycemia. Um, Diabetic ketoacidosis is one of them. Diabetic ketoacidosis. This is overload of ketones present in the blood. When cells don't get the glucose they need for energy, the body begins to burn fat for energy, which produces ketones. When ketones build up in the blood, they make it more acidic. High levels of ketones can poison the body. Symptoms of DKA or diabetic ketoacidosis are thirst or very dry mouth, frequent urination, high blood glucose levels, high levels of ketones in the urine, constantly feeling tired, dry or flushed skin, nausea, vomiting, abdominal pain, difficulty breathing, fruity odor on breath, and hard time paying attention or confusion. The chronic complications can happen when untreated or prolonged hypoglycemia can lead to the development of micro and macrovascular issues. So when the when the veins are affected, many things can happen. Like when it comes to the eye, it comes to retinopathy. When it comes to kidney, nephropathy, peripheral artery disease, cardiovascular disease, bone and joint problems, teeth and gum infections, foot damage, and more. So how do we manage it? How do we manage hyperglycemia? The best way to avoid high blood sugar is for a person living with diabetic to follow the healthcare provider orders or recommendations of diabetic care plan. Insulin is a critical part of managing hyperglycemia for people with type 1 diabetics, while people with type 2 diabetic may need oral medications and eventually insulin to help them manage hyperglycemia. The best way to know if blood sugar is high is to check blood sugar regularly, obviously. So how do we prevent hyperglycemia? Exercise helps lower blood sugar, or we need to assist client with following balanced and healthy meal, and we need to encourage the client to maintain a healthy weight, and we need to also encourage to stop smoking if they're a smoker, or if the client drinks alcohol, we need to encourage them to limit the alcohol because alcohol can raise blood sugar levels. It can also cause dangerously low blood sugar too. So we need to prevent hyperglycemia. We have to assure client is taking diabetic medication as prescribed. If client is refusing diabetic medication, we need to contact the healthcare provider. Now let's go to hypoglycemia. Hypoglycemia is a low level of glucose in the blood or low blood sugar. Usually people develop symptoms of hypoglycemia when their blood glucose falls below 70 milligram per deciliter. Hypoglycemia usually happens suddenly and can lead to loss of consciousness or even cause death if left untreated. What are the causes of hypoglycemia? Taking too much insulin is one. Not eating enough food to cover the insulin intake, exercising more than usual or doing exercise more than was planned, or skipping or delaying eating meals or snacks is the cause most of the time. Signs, symptoms, be on the alert for if you see somebody sweating or chills, or if you see skin pale, cold, clammy. If you take a vital sign, watch for tachycardia, which is fast heart rate, or dizziness, lightheadedness, nausea, fatigue, or intense hunger, or the blurred vision, headache, shakiness, and sometimes tingling in the lips, hands, feet, and confusion, trouble concentrating, nervous feeling, restlessness. So most of them, If blood sugar level continues to drop, The brain does not get enough glucose and stops working as it should. This can lead to blurred vision, trouble concentrating, confused thinking, slurred speech, numbness, and drowsiness. If blood sugar stays low for too long, starving the brain of glucose, it may lead to seizures, coma, and death. There are some stages for hypoglycemia. Level 1 is mild hypoglycemia when the blood glucose is less than 70 milligram per deciliter, but it's 54 milligram per deciliter or higher. It's between 54 and 70. The level 2 is moderate, and that one is when blood sugar is less than 54. Level 3 is severe. The person is unable to function because of mental or physical changes. They need help from another person. In this case, blood sugar is often below 40 milligram per deciliter. When low blood sugar isn't treated and requires someone to help, it is considered a severe event. Severe hypoglycemia is a diabetic emergency. So how do we manage hypoglycemia? The goal is to treat, but not many people who experience low blood sugar want to eat as much as possible until they feel better. This may cause the blood sugar to spike way up using the step-by-step approach of 15-15 or rule of 15 will help prevent high blood sugar. That's listed on your book here. This is the rule of 15. So on the rule of 15, first we check the blood sugar level. If no glucose meter is available and the person has symptoms, assume need to treat them as hypoglycemia. But generally, the rule of 15-15 is have the person eat 15 grams of carbohydrate. Example, it can be a juice, or it can be honey, it can be sugar, it can be syrup, or it can be jelly beans or gummy drops, or 3 to 4 glucose tablets can be. Then stay with the person and recheck the person blood sugar level in 15 minutes. We give it 15 grams of food and then we wait 15 minutes. And after that, we give him another 15 grams. If the blood sugar is still lower than 70, we give them 15 grams of carbohydrate and then we wait 15 minutes. And we have to repeat it again. And if it is lower than 70, we keep giving it to him. And then we need to stay with the person if possible and we have to notify the delegating RN. And if the person becomes unconscious, we need to call 911 right away. So how do we prevent hypoglycemia? The first step in preventing severe hypoglycemia is to keep blood glucose level under good control. So we do that by helping the person keep their insulin or other diabetic medication, diet, and activity level in balance. Now we need to check the person blood sugar as directed, and we need to help the person to monitor their exercise or activity level, or have 15 grams of carbohydrate readily available when it's needed. And glucagon is another thing that we can use. Glucagon is available by prescription only. It's either injected or puffed into the nostril. Injection of glucagon cannot be delegated to a nursing assistant and home care aides in Washington State. So it's very important to remember that you cannot administer glucagon injections under a nurse delegation. You cannot. So when emergency happens, call 911 immediately if the client passes out or loses consciousness. Never attempt to give unconscious person a source of glucose by mouth. Or call 911 immediately if the client cannot safely swallow or use the source of glucose by mouth. It's always safest to treat symptoms of low blood sugar, even if you can't check the blood sugar with the glucometer. And now let's go to lesson 3. I think we already talked about all this. Now, diabetic management in the community setting. Generally, the tips and best practices for you and the client when checking a client blood sugar level is the client hands should be washed in warm water to improve circulation and remove any food residue or lotion. When obtaining blood from a finger, drop the client hand to the side to improve blood flow before sticking the finger. Use the side of the finger rather than the tips to prevent tenderness. Try not to squeeze finger. Squeezing leads to bruising and soreness. If you suspect hypoglycemia or hypoglycemia, test the client blood glucose level for verification if indicated in the client's order. Glucose testing with glucometer. This section showing us how to do it very in detail. These are the general one. The general one are the steps. First, we gather the supplies. Let me see, control glucose, blood sugar. Here you go. First, we gather the supplies, and then we perform hand hygiene and put our gloves on, and we prepare the meter and prepare lancet device, and adjust and load lancing device, and prick the finger, collect blood sample, and we need to get the test results, and we need to dispose the equipment that's dirty. This is the general rule. I will give you the handout after the class. But the book shows you step-by-step instruction, but the instruction is for a specific glucometer, so it's very hard. Sometimes, to tell you the truth, this kind of glucometer or the lancet they use, I don't see it a lot. This is usually happen when people live in their homes, they use it. But in adult family homes like that, we have a lancet or needle separate. It doesn't come with a pin, just like they show. But it's good to know how each one works generally. But the general one is the first step. Let's go step by step. The first step is gather supplies. Gather the relevant equipment and place in a clean tray. You have to put everything in a tray, and your gloves, and your lancet, your stir strip, the glucose reader, and the gauze. You put it together in the first step. And the second step, you have to introduce yourself to the client appropriately, including your name and what you're gonna do. And you have to confirm the client name, and you need to explain the procedure to the client using a patient-friendly language. And then you need to get a consent from the client. Okay, I'm okay. And then you make sure you sit the client in a comfortable position. On step 3, you prepare the meter. You have to check the expiration date on the test strips, and make sure the strips are face up. If the test strip inserted into the meter incorrectly, it doesn't work. So you need to know that. And on the step 4, prepare lancing device. So usually the lancing or the needle, you have to twist it and make the needle available to prick it. And the fourth one is adjust and load lancing device. After that, if you put the needle in, and then you make it ready. And the fifth one is you prick the finger. And the seventh one, you collect the blood, and then you check the blood. You check the blood. You put the blood on the test strip, and you read it. And then the last step, use test strips from meter and place it inside the alcohol swab packet. Throw away in the appropriate disposal container. You have to note that the procedures that we just go over are a guideline, or it's like an example. It's in your book. All healthcare facilities should have policies and procedures that should be followed when performing blood glucose testing with a blood glucose monitor, including cleaning and storage. Also follow the delegating area and directions for performing blood glucose monitoring. Why is it important monitoring blood glucose? Why? Because it helps us with a lot of things. First, It helps the person who's diabetic reach the target goal for glucose, which helps lower the chance of complication. It helps to prevent hypoglycemia or hyperglycemia. It helps the individual learn how food and physical activity affect glucose. It helps determine the right amount of insulin to take. Also helps the provider know whether any medication changes are needed. So the general tips when we check about blood glucose is we need to check skin. A testing site should be clean, and you have to know the best time to check the blood sugar. Usually, we need to check it. If we have to check it, we need to check it after 2 hours after the person ate, and we need to know hypoglycemia protocols generally, and we need to encourage the client to bring glucose record to every appointment with a provider or physician when they go out, because they want to see the reading usually. And another thing is something that you need to know: during times of illness, infection, injury, blood sugar tend to be high, and the client may need more frequent checks. So we need to refer to the client specific instruction, what the doctor wants us to do. Generally, we check blood sugar specific times, usually before meals and snacks, at bedtime, occasionally after 2 hours after eating, before exercise, after treating low blood sugar until normal, when feeling different or ill, we check it, or before driving, we check it. There's two things when we check blood sugar: pre-prandial and post-prandial. We call them pre-prandial and post-prandial. Pre-prandial means before meals. Level assess basal background insulin control. Help make decision about how much medication to take based on carbohydrate content of the meal before the person eat before meal. And another one is post-prandial, which is after meal. Levels evaluate whether individual is taking the correct amount of medication to cover the meal they are eating. So there's two kinds: before pre-prandial and post-prandial checking. And another kind of checking is fasting. Fasting blood sugar. Fasting blood glucose is when a person has not eaten anything for at least 8 hours, and it's performed first thing in the morning, typically within 15 minutes of waking up. Fasting blood glucose level guards the effect of cortisol, a stress hormone, on glucose control, and determines if the individual has enough endogenous, these are insulin produced by the pancreas, or exogenous, these are prescribed insulin, to maintain a normal level of sugar in the blood overnight. So fasting blood sugar is very important to know. There are different locations of insulin injections. If the individual is taking insulin, the location of insulin injection should be noted and at different sites, and because different sites have different absorption rates. Emotional stress, fear, anxiety, anger, excitement, physical stress, all this can elevate blood glucose level, as we talked before. And sleep is very important. Monitoring and sleep, getting enough sleep is important for everyone else, but especially for diabetic people. Diabetic people, they need to sleep 6 to 8 hours every day. If they don't sleep, their blood sugar fluctuates. Recent studies shows too much or too little sleep can increase the risk of hyperglycemia. So the book show us alternative sites where we can check blood sugar. These are very different, on the calf, thighs, hand, fingernails, forearms, upper arms. These are alternative sites. Before deciding an alternative site testing, the client must speak with the healthcare provider about whether this method will work for them and with their meter. Not all glucose meters are approved for alternate site testing. So blood usually flows more quickly through the blood vessels in the fingers than in these alternate sites. but we need to check with the doctor if the client wants to do it. Because the next chapter is medication. I think most of you already took a nurse delegation class, so you know in detail how to give medications. But just to mention it, there is a right client, there is a right medication, there is a right dose, right time, right frequency, right route, right documentation. You need to know all those things when you're giving medication to a client. You also don't remember that you need to check it 3 times before you give medication. The first time you should compare the MAR to the drug level is when you retrieve the medication from the storage area. And the second one, you should compare the MAR to the medication level as you prepare the medication for administration. And the last time you should check the medication level to the MAR is after you can confirm the client receives the insulin shot. So thank you very much. There is a model practice test on this book, page 49 to 52. It has questions and answers too. It's good to practice it. Let me see. It's around here. Yeah, these questions. And also on your book, there's a section on page 120 to 123. It's a job ad for Module 1. It's kind of summarize very important things for you to know. Thank you very much. Have a great time.